Welcome back. It's the lunchtime update, 24 minutes after 1. It's all angles here on ENCA on this Thursday. 5 hospitals and a number of clinics in the Bembe district in Limpopo are facing dire water shortages. In fact, the health department in the province has blamed this on the destruction of infrastructure by a community whenever they protest over lack of water. Let's discuss this now further with Limpopo Health Department spokesperson Neil Shikwambana. A very good afternoon and thank you so much for making the time, Neil. How is the closure of Nandoni Dam affecting the provision of water tankers to the hospital?
Thank you so much and good afternoon to the viewers. What we're experiencing currently is quite precarious because we've got community members who are protesting the community of Buderi, which is next to Nandoni Dam, who have actually blockaded the routes that lead to the dam and also besieged the treatment water plant. Now, on the other side of Toyando, we've got the community there by Vondwe Dam, who have also done the same and also vandalized some pipe infrastructure there. And these two dams are very instrumental in delivering water to our facilities in the area. In fact, they are the main sources. So that has actually led to the hospitals not having water as much as the communities all around don't have water because the source of water for the community is the same with the hospital. So our hospitals have experienced a cut in bulk water supply. And this has caused serious problems because usually when we've got emergency cases of water shortages due to maybe challenges of pipe burst and other things, you would have the municipality delivering water to our facilities through water tankers. But because the treatment water plants and treatment water work stations have been besieged, no workers of the municipality are able to access that area. They can't purify water, they can't access the water through tanks. We're not getting water delivered to our facilities. As a result, our facilities are relying on boreholes, some of which are yielding very little water, which is quite problematic for the functioning of our facilities.
Now, Neil, are there any plans in place for hospital admitted patients awaiting medical procedures?
Of course. Look, if you look at the facilities that we're talking about, it's actually, they range from primary healthcare facilities such as clinics, community health centers, then you would have your district and regional hospitals. Now, if you look at your community health centers, your district hospitals and so on, you've got women who are going there to give birth. If you look at the regional hospital in the form of Chelidzin Hospital in this instance, it's a regional hospital where we've got specialists, various specialists who conduct various specialist medical procedures, which of course requires water. But also, what is more problematic about the situation is that in a hospital setup, you don't only need water for healthcare service delivery purposes, but you also need water for hygiene purposes, because if the hospital is not completely clean, there are certain diseases that can infect patients. So you need water to keep the hospital clean and hygienically neat as possible. So those are some of the challenges that we're experiencing. So if you've got minimal water, you have to prioritize in terms of what do you do with the little water that you're having. For instance, some of our hospitals are not able to do laundry currently because they're relying on 2 boreholes or 3 boreholes that are of low yield. You'll have to take the laundry to other hospitals, probably out of the district, which also comes at an extra cost. So it's a serious challenge that we're currently facing. But we had been assured by the municipal authorities by yesterday that the challenges will be solved. But the update that we got this morning is that the situation is still the same. They're still engaging with the leaders of the structures that are protesting on the ground to get the situation resolved once and for all.
And I imagine, Neil, all hands on deck for you and your team. I mean, let's wrap it up. What's the way forward?
Look, firstly, I think we pinning our hope on the fact that the challenges that are prevailing on the ground there with the protesters and the municipality will be sorted out before the situation can get worse than what it is now. We continue to use the little water that we're getting from bowls, but also Our main challenge as well is that we are trying our best as the Department of Health to push back the scourge of cholera that is gripping some parts of our country and some of those that are our neighbors. If you look at Vembe, it's neighboring Zimbabwe on the north, and we are told that the scourge is actually affecting the province that is bordering Beitbridge there by Mosina. And if you look at the inter-movements between the two provinces, we might then experience the problems. And if we do not have water supply because of the community-induced challenges, that can be problematic. So we're calling upon the community members on the ground there to say they must have a bigger picture in terms of looking at these things, because as it stands now, it's as if they are cutting their own nose to spite their face. Because if one of the people or the protesters were to get injured there in the protest, they are likely going to be admitted in these hospitals. And if they get delayed in terms of getting procedures because there's no water, I do not know who they're going to blame, the Department of Health or themselves, for closing out water for everybody else, including the department.
Neil, thank you so much for your time. That's Limpopo Health spokesperson Neil Shikwambana chatting to us live.